Well, at this point, actually, this is something we still would have to work on with the agency, because there's the two cuts, like I was talking about. There's the $18 million kind of direct cut, and then there's the $10 million associated with the privatization. Just looking at that $18 million cut, we have a rider, and I kind of mentioned it, I know, very quickly as I was flying through all this stuff. It's going to be rider 67. Basically, the intent of that rider is to maintain, as much as possible, all of the forensic and civil beds in the state. So ideally, the idea is to try to get to this $18 million by looking at, some types of efficiencies, cost savings, et cetera. So the intent at this point is to try to retain as many of those beds as possible.
Maintain as many as possible. But you think you can cut $18 million out of the system and still maintain the same number of beds?
Again, I think the reality is that we have to have this kind of discussion a little bit more with the agency. That's the intent of the rider today, but you make a very valid point, how many beds in the end will really have to be cut.
I appreciate that very much, but we have to have a discussion amongst this committee to make those decisions. I can't make a decision to vote for a budget without knowing exactly how it's going to impact the number of mental health beds. Because let me tell you why.
Certainly.
We might try to save $1 at this level, but if we have mental health patients showing up in emergency rooms in county jails, it's going to cost the taxpayers 5 times as much at that level. So we have to be smart in how we deliver these services. So this discussion has to take place in a public setting, in front of this finance committee, for us to know how we're going to vote on this budget. So I know it's early in the process, but I do think we need that type of detail.
Absolutely. I think that's one of the very first things we're planning on working on with the agency. We've already started those discussions.